Hello, my name's Alina. Thank you so much for letting me interview you. Can you give me a quick intro about yourself and your background in public health?
Sure. Hi, my name is Alice. I'm currently a graduate student at Johns Hopkins School of Public Health, studying global health and health economics. I did my undergrad in public health and econ, so basically the same fields. And I've worked for the past 3 years at various global health organizations as well as US healthcare companies.
Cool, cool. What was the field like when you first began your major versus now?
Sure. So, when I started studying public health back during undergrad, the field was very much about public policy, prevention of disease, and basically what steps can we take to ensure that everyone in the US leads healthy and safe lives.
Mhm.
Um, there was this norm where a lot of public health professionals don't really talk or publicize what they do to the public, which is like ironic because the word public is literally in the name of the public health field. But a lot of public health professionals have always been very covert about what they do. The mentality has always been as long as we ensure that everyone has healthy lives, we don't need to tell anyone about what we do. We don't need to educate the public. It's okay.
Hmm.
Because that wouldn't really do anything. But now you see that the public health field is really all about communication, and there's a much bigger focus in the field on just making sure that like average people are educated about what public health is and why it's important.
Yeah, totally. So, did you notice a shift from COVID-19 being a health crisis to instead a politicized opinion? And if so, when?
Yeah, so I think last year when cases started exploding in New York,
Mhm.
and they wouldn't stop, that's when it started becoming both a health crisis and a politicized opinion. So the two aren't mutually exclusive. It's always been both a crisis and like a political opinion.
Mhm.
Um, that was basically when I think the federal government realized that this was becoming an actual problem that the US had to deal with. And they wanted to, place blame on someone for it, to make them take responsibility for it.
Mhm.
Um, Not only to make sure that they didn't get blamed, but also to kind of like pressure other people to take care of the problem for them, is what I would say was really the turning point.
I see. Do you think the previous administration has something to do with the polarization and politicization of COVID-19?
Yes. So, the previous administration, like, of course, there were people who were fighting very hard to try to contain COVID in the US. But then you had people on the other side that didn't believe in public health, and they were trying to lead the country out of the pandemic by ignoring public health, even though the entire point of a pandemic is to, use public health measures to prevent it from spreading.
Yeah.
Um, and that led to a lot of misinformation and confusing messages put out to the public.
Mhm.
Um, when someone sees like a prominent political figure that they know and have like looked up to say that public health doesn't really matter, or like the pandemic is like only temporary, um, then people who don't know public health or aren't educated about it won't know who else to listen to, and
Mhm.
they'll just think that whatever they should do is just keep doing what normal life is, and that like the pandemic will be over because the US has never done anything like this before. So that has led to the rise of anti-maskers and anti-vaxxers, as you've seen a lot in the news,
Mhm.
and just really turning this pandemic into a great divide in the US, when it's supposed to be a time when everyone should come together and try to work together to make sure that this pandemic stop spreading, because that is the one way to make sure that everyone is safe, is to take measures to protect not only yourself but also the people around you.
Yeah, totally. So, how has shifted your view of the public health field versus the public's view of the public health field?
Yeah, so my view of the public health field, I mentioned this before, but I think that professionals in the field definitely need to step up uh, how they communicate public health to normal people, because not everyone knows everything about public health, and that's totally fine. But it's the job of professionals to make sure that they understand and that they know why it's important to, get a vaccine or take certain protective measures. In terms of uh, how the public's view of the public health field has shifted, I feel like there is a lot of confusion. Um, there's still a lot of confusion
Hmm.
around like what exactly the field is. Some people who have never heard of the field probably like don't want to pay attention to it, or they just don't think that it's that important, because it's never really been emphasized publicly in the history of the US, at least like in the modern recent history of the US, like in the past 20 years. Um,
Hmm.
and so I feel like there's still a long way to go in terms of uniting everyone around what public health is and addressing legitimate concerns that the public has. A lot of polarization around the pandemic is building off of years or even decades of heavy distrust in the US healthcare system, which
Hmm.
is understandable because our healthcare system is broken and it's unfair for a lot of people. And at the same time, a lot of people have been feeling left behind by the government, who hasn't been able to fix these issues within like the last 3 decades. So it's not a one-dimensional issue. It'll have to take a lot of work and cooperation between not only normal people but also policymakers in like state and local governments, as well as the federal government, to really, bring
Hmm.
everyone together and help everyone see that public health is important. It touches every aspect of our lives, and it's what's going to, put a stop to this pandemic.
Definitely. All right. Well, that is all the time we have. Thank you so much for letting me interview you, and thank you for giving me your time.
Thank you. It was nice talking to you.
Nice talking to you too. Thanks.